So I guess the first thing, so what was your medical issue that you had?
I had a torn meniscus, which I actually tore in July of 2020. So I am still dealing with it
Okay.
now.
Yeah, and it's October of 2021. So
Yes, it is. Yes, it is. So I
yeah.
finally just had my second MRI done.
Okay. So what happened with the first one?
I tore it, like I said, in July of 2020. Tried to avoid surgery. So basically, I've had steroid injections. I've had
Okay.
2 rounds of PT. I've had surgery. I've had a hyaluronic acid injection, and I've also had PRP.
Okay. So you've had just about everything possible done to your knee.
Everything to try to avoid, obviously, surgery.
Right, right. Because you already had one.
I've already had one,
Yeah.
yes.
So what made you get the second MRI?
I have never not been without pain since I originally tore it. I have never not had swelling since I originally tore it. I'm extremely active. I like to bike. I love to run. Yoga instructor. I lift weights with the boys, I might add. And I got to the point again about 6 weeks ago that I couldn't do those things. I couldn't even do yoga. I couldn't bend my knee anymore. The swelling and pain was all day long, and it was hard to go to sleep at night because that's when I really felt it the most.
Perfect. So you kind of had, this chronic issue, and then you had basically an acute worsening, and that led you to get a second MRI.
Yes.
And then, so after you got your second MRI and you get your report back and everything, what were you thinking at that time?
Well, because of obviously the doctors are extremely busy, and let me say, I love my physicians, love my doctors that I'm working with right now. This is not against them in any way at all. But I had the MRI. Oh, I wish I could think of the dates now. It was probably end of September, beginning of October of this year. But I couldn't get in to discuss the results with my physician until October the 15th. So basically, I had a radiology report that I did not understand at all. I'm a business background, so I can handle your retirement very well. But when it comes to the knee, it's not going to happen.
Yeah.
And I was just trying to figure out what it meant. And I didn't want to necessarily wait until October 15th, because if I needed to back off of some of the activity that I was doing, because until this point, I was told that it was fine to continue about my normal activities.
Sure.
So I was afraid of making things worse depending on what the MRI found.
Okay. And when you heard about the availability of these video reports and what they were about, what attracted you to that?
The fact that I could actually understand what was wrong. One of my favorite things about it is that it compared my bum knee to a good knee, right? So I could physically tell side by side in detail, this is what it's supposed to look like. And this is what my knee does look like. And I've never been able to see that together before, because the doctor, generally in most instances, when you're in the appointment, points out what is wrong on his screen, but you never compare it side by side to what a good one is supposed to be.
Yeah, and how did you feel seeing your knee was not quite normal?
Well, I was upset because, like I said, I have not met with the doctor yet, but at this point, I'm thinking from looking at it that surgery is where I'm headed again, and I'm not very happy. I had lots of big things planned in the spring, and they're probably not going to happen with time off again.
Yeah. Well, so seeing your knee against the normal one, and then now you said, "Oh, I'm probably going to have surgery." Did seeing it make a difference to how you feel about that, or how did that play into it for you?
I think that knowing what is wrong again, versus my whole thing is now I feel like when I go into this appointment on Friday that I'm prepared. Doctors are phenomenal. they're busy and they have a lot of patients, and I've had great quality of care. Don't want it to sound that way. But when you walk into an appointment, if you don't, well, the saying, you don't know what you don't know, right?
Right.
So you walk in and you're having a discussion based off of what that doctor wants to talk to you about. In most instances, most people don't even go and get their radiology report before their doctor's appointment, nor do they know that that's even a thing, right? To look at it ahead of time. Right. So you're talking about what the doctor deems important, which in most cases, it'll probably be the same thing. But after everything that I've gone through, I wanted more information before I go to this next appointment to make some decisions about where I want to go from here now.
Sure. Yeah, no, that makes perfect sense. Of all the things that you got in the video report, what would you say your favorite part was?
I liked when he actually showed me what the meniscus looked like. I had no idea that it was almost like a bow tie, or it should almost look like a bow tie. Sure. Obviously, mine does not. But the fact that that's what it should look like compared, I think that we can see if they point out, oh, here is a tear, but we have no idea what it should be. And I think that that was the big thing for me, is to know this is what things should look like.
Yeah, and we sometimes forget, like we can say, oh, you have this knee cushion or whatever, and people are imagining kind of like a throw pillow or something, you know, like what does that mean? Sometimes we forget where people are at with what they're visualizing medically, and I think that, you know, that's why we have the art and stuff. Did you find the art and the 3D models and stuff helpful?
Yes, loved it, especially when it turned around and you could see the direction that it was coming into before it actually gave you what it was that you were looking at. I'm a super visual person, and I have to have that comparison. And someone pointed out, like, I'm the one that never could see a baby in an ultrasound, let's be honest. Like, that is not natural for me.
You're not the only one, by the way.
They're a lot better now. I mean, 20 years ago, ultrasounds are not what they are today. And no, I could never even tell you what was the head of one of my children, but.
What do you think the biggest way this video report helped you?
Like, honestly, I can be prepared. I've never felt prepared before. I know what to expect going in, so I can actually ask the questions now that when you're caught up in the moment and you hear someone say, oh, and it looks like you may have a new tear in your meniscus again, right? So then your mind would immediately go to, oh crap, that's surgery, blah, blah, blah. I've already come to terms with that now, so I can go in and ask other questions. How did this happen? You know, those types of things. Yeah.
So you feel like you're not kind of starting like this. You're feeling like you're more, you know, on the level, and then you can get down to, you know, business, so to speak. With
absolutely. I'm over the shock. I understand what it is. When he pulls it up on his screen, I already know what I'm going to look at, which is very helpful to me. I don't like being unprepared in anything. And it was really good to know what it was that I was seeing. It's kind of like obviously y'all don't diagnose, you don't do that, but I feel like it was almost a second opinion on the MRI, like a second set of eyes on the MRI, that I can feel confident in what it is that's wrong. Now I just need to figure out what the next step is to fix it.
Yeah, you've touched on actually a really big thing that we've learned is that, you know, millions of people in this country look for second opinions. And, you know, as you alluded to, you know, we are radiologists, we do interpret images, but for Mediphany, we don't, right? We just provide the education. But we've found that most people, and you can correct me if you feel like you're in this or not, but most people are looking for a second opinion, but what they really want is an understanding of their first opinion.
Absolutely.
You know, that their first opinion was, you know, they just didn't understand it. So like, well, maybe if I get a second opinion, I'll understand it more, or like it better or something.
I think it's more validation is you want validation that what you've heard was correct before you can move on.
Yeah.
And understanding is just huge. I mean, I don't know. I think that oftentimes we don't understand things that are going on within our bodies. But I really, like I said, with this and the whole reason for another one, I just kept telling that something's not right. It hurts something from the moment I had my last surgery. Something has not been right.
Right.
And for me, it was actually a relief to actually see something show up in the MRI, because at some point you're like, I feel like I'm going crazy. Like I have complained about this forever. And why isn't any of this stuff working? And now it makes sense as to why it didn't work.
Right. Because you have there's an actual structural problem there that you could see.
Right. And it wasn't, I mean, so I felt so much better.
Yeah.
So much better after understanding it, I will say.
How did you like the length of the video? Was it too long, too short?
No, it was perfect. I actually feel as if you all could charge more. I feel like that. I know. Is that crazy that I'm saying that?
Well, no,
I feel like what I got for the time that you all put in it.
Yeah.
I mean, considering what other people charge for less than, or, you know, it was less than a mani and pedi, let's be honest.
Yeah, yeah. Let's say you went to get a second opinion. That could cost you hundreds of dollars, if not $1,000 or more.
Well, and the second opinion, more often than not, it's going to require another MRI from their hospital because of their thing.
Was there anything that surprised you?
Well, how messed up my knee still was a little shocking after everything I've done. No, nothing that was surprising about your video. Surprising about how in the world was I still running 5 miles on a knee like that. No wonder it hurt, right? And that was me backing off. Like that was me doing slow runs. And I'm like, I have no business running, period. I don't know what I was thinking.
Right. Well, and you bring up a really good point, because, you know, this is another point of this is like, you know, okay, you get this written report that you don't understand.
No, posterior horn. I have no idea what a posterior horn is.
Right. And you go run or whatever, right? So like let's say that instead of getting your written report, you had gotten this video report, that would have changed your outlook on your knee, right? And what you were doing.
Yes, as soon as I got your report, not gonna lie, I gave myself permission to basically just stop. And I put my old brace back on. I kicked the high heels to the back of the closet. I'm back in my lovely flat orthopedic shoes for the time being. And like I stopped 2 weeks before I probably would have because I just didn't understand it until I went into the doctor, and I'm like, oh my gosh, like I need to stop. As long as I think I'm somewhat healthy, I'm going to be active. I can't stand to be still. So this is actually really hard for me, not gonna lie.
Yeah. Just to kind of summarize your feelings here. So you said that, so this video, it stopped you from really seeking out an expensive second opinion. It has prepared you for your next doctor visit.
Absolutely.
And it's allowed you to treat yourself more appropriately.
Absolutely. Like I said, a lot of us have great doctors. Sometimes you can't get into them next day. I mean, that's just how healthcare is. And I think that in the past year, it's been even harder to get appointments and to get in to see doctors because of different protocols and things that are in place. So it allowed me to actually know what's going on before I see my doctor again, and then we can come up with a plan together. And I feel better about having that conversation now.
Yeah.
And we can focus on what's next rather than as much as what's wrong, because I understand what's wrong now.
Right. Exactly.
And they have a limited amount of time. I mean, let's be honest, they can't spend 2 hours with every patient. Unfortunately, I know that they would probably like to, but they just can't. That's not the reality.
Yeah, and that's why we really wanted to have the videos be essentially permanent, right? So like that's the other thing that we would feel like patients would kind of understand in the office with the doctor, then they'd go home and they'd say, well, what did he say? Or what, what was that term that, because you didn't really know the term in the first place, so how are you going to remember it? So now,
Absolutely.
How do you feel about the value of being able to basically watch it whenever you want?
It's amazing. And on to your point, oftentimes when you're in those appointments with the doctor, you spend so much time trying to take notes and get everything written down, or you're trying to record it on your phone. Right. So you can go home. And then that's when you have the questions once you start doing your research,
sure.
Which I think is just super helpful. And correct me if I'm wrong, and I'm sure that you will. I believe, though, if I do have future MRIs, I can upload it and I could have a comparison at a later date. Is that correct?
Yes.
So it will be there. It will stay there and it will be there. So I can always go back and compare with something new, correct?
Yes.
Obviously, you would pay again. Don't get me wrong. It's not like that's included in the first fee, but you can do comparisons as well.
Yes, absolutely. Yeah. So what you would do, like, let's say you got another MRI. So what you would do is, so right now you paid for, one video report. So if you get another one, you would just upload that study. And then if you wanted a new video report on that one, then you would upload it. And then we would notice there's a comparison, but if you wanted, you could put in the comments, please compare to my prior or whatever.
Right.
We would anyway, but that's that's certainly the goal. I mean, we do that with imaging anyway, but yeah, that's certainly the goal. So that way you get even more out of the video report, because we're going to show you, not only would we compare it to normal, but we'd compare it to your previous.
Right, which I think is really cool too, especially if you have something that's different than a knee, something that could be more progressive, a different injury or a different diagnosis that required multiple images.
Yeah, and that certainly happened.
Back to your breast cancer as to what you said. Right. That's what came to my mind, because obviously it's October and it's everywhere. But I think that in that instance, it would be extremely helpful what you do.
Yeah, we can definitely do that. Do you have any advice for us?
No, like I said, I thought it was amazing. I think you could charge more. Like I said, I'm paid more for a manicure and pedicure than I did for this. And it's way more valuable than having pretty nails for 2 weeks.
Yes.
I'm very sarcastic too, sorry. So yeah, no, I think it was awesome.
Yeah. All right. Well, that's all I have. So thanks for
thanks for
chatting with me here.
It was nice to meet you.
Yeah, you too.